Obtaining the blood sample. Blood request form. All blood request forms must contain certain information, starting with the patient's full name. Abbreviations and names is not acceptable. Patient's date of birth, patient's NHS number, patient's hospital number if they are an inpatient. Requesting physician's details. This is the name of the physician and a bleep number. Clinical information. Clinical information must be included on the form when tests are requested. Blood samples required. On the forms, the blood samples will be indicated as to what has been requested to take. Assemble equipment. Pulp trays, plastic trays. This will carry your equipment to your patient from your station. Sharp spins. These need to be in a safe distance from your patient whilst you're practicing venipuncture, but also within easy reach so you can dispose of your sharps. Needles and vacutainers. These should not be assembled until you are with your patient and you have got consent and you have identified you're with the correct patient. Medical wipes for the skin disinfectant. These should be used for 30 seconds on the site that you're prepared to do the venipuncture, but also allowed to dry for 30 seconds more. Cotton wool, which will cover the site once you have finished. Tourniquet, which is applied to the patient's arm or wrist depending on the site of venipuncture. Medical tape to affix the cotton wool to the site once the procedure is over. Gloves. The phlebotomist should put gloves on before they assemble their equipment. Leak-proof specimen bags. The sample should be placed in these once they are labelled. Correct amount of sample tubes. This is important that you take the correct amount with you. It is always a good idea to take extra in your pocket just in case the tube comes away from the vacutainer. Venipuncture. Explain to the patient the procedure that you are about to carry out. As simple as, "Hi, I'm Marie, I'm here to take some blood from you." Position the patient to a position that is comfortable for them but also workable for you. As a phlebotomist, there is a lot of bending and stretching. You need to protect your back and shoulders. Ask the patient to extend their arm. Apply the tourniquet approximately 2 to 3 inches above the intended site. This is to give you a good restriction of flow. Instruct the patient to make a fist if possible. If your patient is suffering from rheumatoid arthritis, they might not be able to make a fist, but you could put something into their hand to make their grip a little tighter. Clean the chosen site with an alcohol wipe for 30 seconds and then allow the site to air dry for a further 30 seconds before obtaining the blood sample. Insert the needle at a 15 to 30 degree angle, which is the most productive angle to obtain the sample. Attach the sample tubes in the correct order of draw. If this isn't correct, they can be contaminated and the results can be wrong, leading to misdiagnosis and mistreatment. Loosen the tourniquet. A tourniquet shouldn't be applied for any longer than 1 minute through the procedure. Remove the needle and firmly press on the cotton wool site for 2 minutes and then apply tape. Labelling of samples. Samples should always be labelled whilst you're still with your patient, whether it is done at the patient's bedside, with printed labels or handwritten. Once samples are completed, they should be placed within a sample bag along with the request form ready to promote transportation to the lab. It's extremely important that you only bleed and label one patient at a time. Things can get mixed up and again, misdiagnosis. Samples should arrive in the lab in a timely manner. If this does not happen, samples can hemolyse, which means the blood clots, resulting in a delay of treatment or a need for the patient to be bled again. Sites to avoid. Phlebotomists have areas that they must avoid when choosing a site to perform venipuncture. Arms that have been used for surgical procedure, the patient may be still in some discomfort. Also, implants may have been fitted during the procedure. The side that a patient is receiving a blood transfusion should also be avoided. This is due to the fact that whilst the transfusion is being given, the blood results, if the sample is taken, would be incorrect. Arms or hands on the side or sides that a patient has undergone a mastectomy. Generally, phlebotomists do not bleed mastectomy patients due to the fact that it can cause lymphedema. Above an IV cannula in the same vessel. Phlebotomists do not bleed above this site due to the fact of the interference to the cannula itself. Arms or legs that have currently had or pre-existing blood clots, the patients do generally tend to tell you that you're unable to use that arm due to having a pre-existing blood clot. Edematous sites. Swollen sites filled with fluid. These sites are to be avoided. They can be painful for the patient, but they can also corrupt the blood sample. Fistulas and grafts. Again, patients with these tend to inform the phlebotomist that they're unable to use that site. Scars or burn sites. These are to be avoided due to that they are potentially tougher to get the needle through, making it more uncomfortable for the patient. Arms with PICC lines. PICC lines are generally fitted to patients that are on chemo or aggressive treatment. Phlebotomists do not bleed from a PICC line, and these requests would have to be handed over to the nurses. Edematous arms. These again are avoided because it's uncomfortable for the patient. Feet of diabetic patients. If you are unable to bleed a patient, you can use the arm, but you must always ask that patient if they are diabetic. If they are diabetic, the foot is a no-go area. This is because you can cause serious infection. You would put the blood request back to the requesting physician. Arm with an open wound or infection. Again, it's common sense. If there is an open wound, you would not then proceed to put a needle into that wound.